Approximately 20 to 25% of our sleep is REM sleep, which is rapid eye movement sleep, when our body muscles lose their tone and are almost like they are paralyzed, but our eyes are moving. So this is why it is called rapid eye movement sleep. Now, during a course of a night's sleep of approximately about 7 to 8 hours, we all go through about 3 to 4 cycles of non-REM and REM sleep. So approximately every 90 to 120 minutes, we have a REM sleep, and initial part of the night, the REM sleep is fairly short, just about 5 minutes to 10 minutes. But as we progress through the night, particularly early in the morning, when we wake up, we often wake up from a REM sleep because it's almost about 30 to 40 minutes long. Now, why is this important? Because we remember only dreams that happen in our REM sleep, which is why we often wake up very clearly remembering a dream, but we may have had other dreams during the night that are very, very fuzzy because it might have happened during your non-REM sleep. So, when I mentioned about insomnia, it is not only the quantity of sleep, but also getting a good quality sleep with all these various stages in the right proportion, and so that you wake up feeling fresh in the morning. Now, if somebody has a problem with sleep only for a fairly recent short period of time, by that I mean about 3 months or less, then we call it as a short-term insomnia. Remember, all of us may lose a rare night's sleep, and that's not insomnia. I mean, we might be out for a party, or we may be busy with some family occasion or any of those, and not sleeping one night because of this is not called insomnia. If you are having trouble sleeping unprovoked by no other reason, and it is persisting for 2 weeks or more, then it is better to see a doctor so that you could take care of your sleep problem. And as I mentioned, if it is less than 3 months, we call it short-term insomnia. If it is longer, then we call it as chronic insomnia. Some people get what is called intermittent insomnia, where they are sleeping fine for a few days, but have trouble intermittently, and that also needs to be addressed on why that is happening, and if they have any specific triggers, how those could be prevented. So we talked about lack of sleep. Now let's talk about people who sleep a lot. These are people who often do not seek consultation because they think that they are normal. They think that they do not have a problem with their sleep because they are always sleepy, and during the daytime, even while at work, sitting in front of a desk, they may be sleeping. There are people who sleep while driving. There are people who are just watching TV and dozing off, and all of this is referred to as daytime hypersomnolence or excessive daytime sleepiness. And one of the most common reasons for this is a condition called sleep apnea. And the symptom of sleep apnea is something all of you would have heard, and that is snoring. If not you, the others whom you see around, whether it is in a flight or in a train or your bed partner, when they are snoring, think whether they could possibly have sleep apnea. What happens in sleep apnea is interrupted airflow to the lung because the upper air passage muscles are collapsing, and therefore people are not getting enough air to the lungs, and the breathing might slow down or stop. And stopping breathing is called apnea, and since the problem happens during sleep, we call this as sleep apnea. And what this does to your system is, number one, snoring, which others hear. You may wake up often in the night with dryness of the throat, mainly because of mouth breathing. You may have a desire to urinate frequently in the night. And when you wake up in the morning, you do not feel fresh. Often some people say they wake up with a headache, or they feel irritable during the daytime. They feel easily sleepy during the daytime when they are in a dull moment, sitting in front of a TV or reading a book or any of those. Then it gets to a point where even when they have to concentrate, like driving or at work operating a machine, they may fall asleep, which could lead to accidents. Now, in addition to this problem, the lack of sleep and the lack of oxygen, the lack of good quality sleep and lack of oxygen also starts affecting the blood vessels, and therefore people with undiagnosed sleep apnea, if you're not treated, may develop high blood pressure, or if you already have blood pressure, it may be getting more difficult to control. You may be requiring more and more medications. It can lead to diabetes, and if you're already a diabetic, it can lead to what is called uncontrolled diabetes, where you may require more and more medications and your blood sugar is not coming under control. It could also lead to heart disease and stroke, and therefore snoring, which is a warning symptom of sleep apnea, should not be ignored, and if it is causing daytime symptoms, needs to be addressed early so that we can prevent all the complications that I just spoke about. Now, in addition to sleep apnea, there are some rarer conditions called narcolepsy that can also lead to daytime sleepiness, but that's far and few. And people who are sleepy often think that they have narcolepsy, but that is a very small proportion of patients with sleep problems. What else can happen during sleep? What are the other common sleep disorders? There's a condition called restless leg syndrome, where people feel that their legs are crawling, creeping, they feel like shaking their legs, they feel like getting up and walking, and they just can't control it. They are unable to initiate sleep and they have difficulty sleeping, and it could also lead to a non-refreshing sleep. This restless leg syndrome is often associated with pregnancy. It is also associated with several other problems like diabetes, kidney disease, anemia, particularly iron deficiency, and also not to forget any chronic pain syndrome. By that I mean people with long-standing back pain or knee pain or leg pain, any of them could develop restless leg syndrome. Now, this is a clinical diagnosis, and if we do find that somebody has restless leg syndrome, we obviously do appropriate tests to find out what is causing this and treat that as well. But additionally, this can easily be treated with some, like physical measures and also with medications if required. Other medical problems, other sleep problems include circadian rhythm disturbances. The simplest and easiest one that most people can connect with circadian rhythm disturbance is jet lag, because our body has an internal clock and it responds to what we call zeitgebers, or an external stimulus, which is often light. We need bright light during the during the daytime to synthesize vitamin D when our body's melatonin level goes down, and in the night, in darkness, the melatonin level goes up. And this cycle and the cycle of several other hormones in our body happen based on the day-night cycle and also based on when we are awake and asleep. And therefore, if these are not in sync, then we could develop what we call circadian rhythm disturbance. Often happens in people who are working shift works, who are unable to sleep at hours that their body is not allowing them to sleep, like those who are doing night duties constantly may find it difficult to sleep during the daytime. I want to close with talking about what we call parasomnias. These are any abnormal behaviors during sleep. By this, I mean those who are sleepwalking, sleep talking, sleep eating. Anything that is abnormal during sleep needs to be assessed. Some people have this extremely rarely, but for others it may be more frequent, in which case it needs to be assessed and treated appropriately. So to summarize, I want to say that when we think about wellness, the three pillars of wellness are diet, exercise, and sleep. And sleep is often ignored or taken for granted. As adults, all of us need at least about 6 to 8 hours of good quality sleep. So it is not just the quantity of sleep, but we need good quality sleep, and that would help us to wake up feeling fresh, and more importantly, contributes to our wellness and prevents several psychological or psychosocial problems and physical health problems. And therefore, do not take your sleep lightly. Practice the sleep hygiene measures that we already talked about. Sleep on time, wake up on time, sunlight exposure in the morning, having your meals on time, particularly dinner at least 2 to 2.5 hours before bedtime. Avoid stimulants at least about 4 to 5 hours before bedtime. Prepare your body to sleep with some unwinding activities and dimming the lights during the night. and you may consume milk or milk with honey or banana or chamomile tea, all of which are sleep inducing. Get a good night's sleep because a good night is essential for a good day.